late to mute themselves?
Yes, I can do that.
Cool, thank you. All right, welcome to UNAVSA's, Civic Engagement's first webinar. Woo! This month of May is Mental Health Awareness Month, as well as APIA Heritage Month. So we wanted to throw this webinar together in order to talk about mental health issues within the Asian American community, and possibly even specifically the Vietnamese American community. I'm David. I will be hosting this today, and I'm the Civic Engagement Director. Been part of UNAVSA for quite a long time now. It's my first time doing this webinar, so forgive me if I do anything strange. And joining us is our very, very special guest, Diana Chu.
Hello, everyone.
Woo. Diana is a marriage and family therapist and a registered drama therapist. She provides mental health consultation, crisis intervention, and early interventions at preschools through the Richmond Area Multi-services in San Francisco, and provides online drama therapy. She works with children, teens, adults, and families. And she also hosts a podcast called Waves of Change, which focuses on modern perspectives on Asian American psychology. When not working, she loves spending time with her 2 huskies. So I'm going to let you introduce yourself soon, Diana, if you want to add anything to that. But first, I want to talk about the webinar rules of engagement here. So this webinar is a safe space for everyone who's joining here. So no judgments, just if you want to stay anonymous, you can call in or introduce yourself before you speak if you do not want to stay anonymous. And then we have some questions in case a WUFU form, in case that you do not want your voice to be heard or anything like that. Please mute yourself if you're not speaking, and while Diana is speaking, and wait until the person who's done talking before you start speaking. And you're also welcome to type questions on the sidebar as well. That should be it. Make it a fun space. We're here to learn a lot from Diana. She is amazing. And I'm going to pass it over to you.
Okay, thank you so much for the introduction, David. This is new to me, like that, doing a webinar rather than like meeting with clients online. One thing about me is that I recently come to the States, like maybe like 4 years ago, to pursue drama therapy, which is a form of counseling psychology. Before that, I did my bachelor's in University of Toronto in Canada, which focused on psychology and also theater. So the drama therapy aspects is like merging both theater and therapy together. And the work is very different from the typical let's sit down and talk kind of counseling, but it's more like embodied, more movement-based, and all those good stuff. So for today, we're going to talk more general about therapy, mental health, any questions that you have regarding your life right now, or like stigma along in mental health. We can dive deep into what is depression, or like PTSD, or into how do I find a therapist, that kind of good stuff. So I'm a licensed therapist in California. The licensing system is maintained by state, so I can only work within the state. So that means I graduated from a master program and also earned around 3,000 hours afterwards. So it's a really long time to get licensed as a marriage and family therapist. Other than that, I'm a registered drama therapist, which means I could do drama therapy within the nation. So that's how I introduce myself. I'm from Hong Kong. I am new to America, but I learned a lot about America through my clients and also my studies here.
Fantastic. So I think if you can talk to us more about why people typically seek mental health. Why people typically see you, actually.
Yeah. So a lot of people go to seek mental health services, which means it could be individual counseling services. It could be family therapy. It could be play sessions or play therapy with kids, or even couples therapy. So there's like different range of why people do that. Of course, the easiest answer is, oh, when you think you have a mental issue, which is really easy to detect. For example, you have delusional or like hallucinations. Of course, it will be, yes, you should go to see a counselor. But to me, I myself as a therapist too. And the reason I do that, I have a therapist, is that I think the mental space, mental health is really important. It's like, David, if you go to the gym to keep up your health, your body once a week or even more than that, why not give yourself space in a therapy session to work out for your mind? So that's how I see it. And therapy is very different from a traditional friendship kind of relationship because it's confidential, and the therapist would guide you to places where you could actually process what's happening with you in the relationship that you have, how you attach to your partner or your family, and how to break patterns that you would like to you would like to shift. And of course, if you're depressed or having some other issues in life, then that would be very helpful as well.
So I know in the past, like a lot of, at least in the Asian community, mental health issues are very stigmatized. Have you seen that change lately amongst your clients at all, or in general?
So it really depends on the population. Right now, I work primarily, like 80% is like low income families. And the way that I talk to them about it is that, hey, it's a free service that provided by the government. Why not support your family or like yourself when it's free? So that works really well in the Asian community. But at the same time, when people have like more education level about like, oh, good counselor is like about mental health, then it becomes a stigma. And I tend to use it as strategies and skills that you could build. And a lot of therapists brand themselves using those terms as well. How do I build more even like relational skills? How do I be a better manager? So those kind of like buzzwords also would be ways. I do have clients who are really old, who are like elderly, like 70, 80, 90 years old, and they see therapy as chit chat. So I'm just talking to my counselor for chit chatting, right? So it depends on the language which works for the population.
Of course, us Asians would gravitate towards something free, right?
Yeah. And definitely if I do a group and I have funding for food, they'll come easily.
Nice. Yes. I think another question that a lot of people have is, how do you talk to someone? How do you break that stigma of talking to someone about mental health? Like, if someone opens up to you about mental health, what are the do's and don'ts about that? Yeah, I'll start with that first.
Yeah. So I think in general, obviously, like Asian communities have like the kind of like the collective kind of way of thinking. So encouraging them to talk to different people, it's like the first step. But when you want them to go and seek help, specific help in terms of mental health, one thing you can provide is like resources for them, and also the way that you talk about it without any judgment, without any um, uh, like uh, hidden agenda on how to proceed that. I think the analogy that I use about the gym works really well for people, and also talking about like what you hear from other people, the benefits of having a therapy session. If you haven't tried it yourself, I would highly recommend you to do it. I started therapy like 3 years ago, and I learned so much more about my own issues and like what presses my buttons, what some of like the relationships that I would want to work on, or even like couples therapy on how you relating to different people healthier. And so think about it as like a skill, a course that you learn about yourself, about your mind. And it works really well when you have a better mental health. You work better in your work, and you have better relationships with people. Yeah.
Nice. I think that's what is good for some warm-up questions. Let's open it up to the audience and see if anyone else has any more personal questions you want to ask. Let me remind you guys that this isn't really a session, like a therapy session for yourself, but more of a general knowledge gathering session. So feel free and pipe up and ask. You guys will have to unmute yourselves.
Hey, I guess I'll ask the first question. This is Tin. I guess what I'm curious about is a lot of times mental health, we talk a lot about it, especially in today's like age and everything. But a lot of like, especially in the workforce, a lot of companies don't really sponsor insurance plans for mental health. And if you try to like seek therapy sessions, it can like add up and be very costly. So do you have any recommendations or tips on how to address that kind of thing?
Yeah. Yeah, that's like the first thing that people ask, how much is it, right? Um, yes, there's a lot of companies right now which is like more and more open about mental health, but yes, there's way more companies which is like not in their health insurance plan. In San Francisco, a lot of people use their health card to do it. If you're a low income, there's like Medi-Cal, and I'm quite sure that in different states there's like different programs. The second thing is like there's a lot of nonprofits out there. Nonprofits could range from providing services to family, to homeless people, or drug and addiction, but also there is nonprofits who gear towards what they call outpatient programs. So outpatient programs is basically people can drop in and have a session with the therapist and a low fee, low sliding scale fee. A lot of those programs fix the fee based on the salary, and how the family or like how the person could attribute it or like financially be comfortable with paying for therapy. Another thing is that a lot of private practice therapists have sliding scale. So what I mean by sliding scale is that if I have like 20 clients in my caseload, maybe like 3 or 4 clients, I'll be able to do like a low fee service. So I would recommend what you do is that you find a therapist that you want to work with, and then you ask them if they have sliding scale available. And of course, how much you pay for therapy it's in respect to like, you want this, you want your therapist to be well as well, so that they could financially secure their job and their well-being as well, right? And the training is like so long and thousands of hours of like expertise. You want a good therapist, and obviously good therapists typically have more experiences and they have the market, and of course they charge a little bit higher. But I would suggest like there's also interns who would be able to do the work as well if you're not like a high risk person with mental illness, which I meant by like suicidal or like have delusional thoughts or hallucination, those kind of symptoms. Then an intern, I think, would be the financially sound choice. Ken, does that answer your question?
Yes, it does. Thank you.
Okay. Any more questions?
Sure, there are. If not, I have a couple questions of my own. But for now, anyone else, feel free, jump in.
I have a question. So, I know someone who's like suffering like emotionally, and like the signs are kind of like obvious and stuff. What should be like the first approach I should take in the, helping them out?
So you're talking about like if I have a friend who is going through like issues or that have stressful moments in life, how do I help them? Or how do I, as a friend, help them? Right. So definitely seek professional help if that's available. Or if the person is not open, then I will recommend you to be the listener. So one thing about therapy school is that they train you on how to be a good listener without judgment. And one of the steps is that you're curious about the person, and also you're not afraid to ask questions in a non-judgmental way. So for example, prompting questions like, I noticed that you're tearing up. Could you tell me why? And it's okay that if you are not ready, I'm here for you. Telling people that I'm listening, I am here for you, and I could be available. And the tricky part is that you're not a mental health provider. So I would always say, like, if I don't know how to solve the issue that you're dealing with, I would like to help you to find someone who could help you. So, and that you could be the bridge, which link a person who is suffering right now, essentially, to get help. And it could start from small. A lot of therapists provide free consultation sessions. I do myself as well. Like I provide, if someone wants to be a client and work on something with me, I provide free 15-minute consultation. And you can always tell the person to give them a name in your community, or like in a therapist which is close by, and tell them to call them for a free consultation. Yeah.
Thank you.
You're welcome.
That was a good question. Thank you.
I also had a quick question as well. In terms of having, pretty Asian American parents, it's how does one go about addressing that about mental health issues, especially to their parents, especially if your healthcare is kind of linked with them? It's kind of difficult to kind of convince them of that you need therapy or you need, other resources available. But how should one go about addressing that to one's parents?
Thank you for the question. That is very tricky. I work with kids before, and in California, you have to check with different states, but most likely in California is that if you are 12 years old, you could sign your own consent on therapy. So if I wanted to work with a kid who have behavioral issues or like going through a breakup or something like that, I will have them, hey, do you want your parents to know that I'm working with you? And some kids say, oh, it's okay. Some kids say, no, I don't want to, especially when there's like trouble at home as well, like the conflict is at home. So I will have them sign a consent by themselves. And the starting age is 12. So I would assume that you're over 12, and I would say you could actually go to your provider and get therapy without consent of your parents. And that was something that you could do some research on and on how to do it. I would suggest calling the insurance and calling your provider, therapists that you would like to work with, and tell them your situation and ask for a consultation on how to work towards that. Some therapists would charge the insurance, and then there's like a small fee that you will pay the difference or something like that. So you will work it out with the therapist. And of course, you can always go to nonprofits, which take full insurance. Yeah.
Gotcha. Thank you so much.
You're welcome.
Can I follow up on that question real quick?
Yes.
So say you're on your parents' insurance.
Mm-hmm.
How much privacy is there when you go to see a therapist? Like, will your parents know? Or is there like a agreement of privacy between the client and the therapist, kind of like a client lawyer, client attorney privilege type thing?
Yes. Yes. So every therapist has a thing called confidentiality. So whatever you say with a therapist is confidential, which means there's only two things that would lead to a therapist break confidentiality. One is when you are harming yourself, which means that you're in danger, and of course the therapist at that point will find someone who is in the emergency list or your school counselor or something like that to support you because you're at risk. The second thing is that when there's abuse happening, if you're a child or if you're in a household with the children that you witness an adult is hitting a child, and that's when the therapist would break the confidentiality. It also happens with 65 years old or older, so that's called elder abuse. So whatever you say in a treatment or like in therapy, it would be HIPAA compliant, which means all the notes that I type or the notes that therapists type was all HIPAA protected, and it won't be shared to other people. And when sometimes people think like, oh, it might be a good idea to share with your parents about your treatment, but you could always say no. And also telling the therapist, hey, I only want you to tell them about A and B, but not about these things, So only when you're at risk, the therapist will break confidentiality.
Thank you. Anyone else have any more questions? My committee members, you guys have any questions?
Hi, Diana. So I had quick questions. What are some ways to kind of assist someone that's going through a panic attack or an anxiety attack?
So that's very specific. A panic attack and an anxiety attack happens really quickly. One thing that you could do is think about grounding the client, the person. So what I'll do is like do a lot of breathing. If the person could not breathe with you, you take deep breaths yourself. Another thing that I typically do immediately is that I'll kneel down. If they're sitting down, I'll kneel down next to them and place my hand on their thigh or on their shoes so that they could feel the ground. So that's how I would do a panic attack. But at the same time, when you feel like the person couldn't really breathe or have like asthma symptoms back, like they have like asthma history, you will have to call 911 immediately. And hopefully there's someone who is like helping you with it. So that's panic attack. And also having the person go to a mental health counselor to so that they could have skills to prevent that from happening. So a lot of things that like panic attacks, you could actually use different therapy techniques. Like it could be CBT, it could be like somatic therapy to support the person. Yeah.
Could you explain to everyone what CBT is, just in case people don't know what CBT is?
Yeah. So CBT, actually, I should just explain. So therapy is like, think about therapy as like Kung Fu, right? Kung Fu has like different styles and ways to attack a person or to protect yourself. And CBT is one of the ways, and that's how we call modalities or like theories. CBT is cognitive behavioral therapy. So is using like a process which tracks your cognitive thinking and how it relates to your behavior. So for example, there will be when I'm really mad, I would actually leave the conversation. So that's a cognitive thinking and also a behavior, right? And when you figure it out, when you're really mad, you leave the conversation. Then you think about like how do you better address the issue? You have to stay there to so when you figure out your pattern, you could change your pattern. So that's CBT. A lot of times I use it in drama therapy as well. Drama therapy with CBT. So not only there's CBT, there is like psychoanalytic theories, there is somatic theories, there is narrative therapy. There's a lot of different therapies. And one thing I wanted to add is that not everything with different forms of therapy works well with people. So for example, if you're a body person, somatic therapy might work well with you, works best for you. Or even if you're like a very cognitive person, I might not suggest you to go to CBT, right? I might suggest you to do more of like an imagery or narrative therapy, you know. So when you pick a therapist, Google what their orientation is and see if that aligns with you. And also you could always go to a first session and say, hey, this is not my jam. And you figure out like what's best for you. Yeah. It's like dating, you know, therapy finding it's hard. It's hard to find a good therapist. There's like cultural competence, there's like language, there's like their way of working, right? So you have to try in order to get the best therapist and best treatment that you have. Yeah.
Dan, I had a question. Hi, I'm Kevin. When you're trying to help somebody dealing with something and they ask you to not tell anybody else, but you think that the situation might be escalating, what is the best thing to do?
Okay. So as a friend, are you asking as a friend?
Yeah, I guess like if you're the friend and they are asking you to respect their confidentiality, but you feel like it's escalating.
Okay. Yeah. Typically, I will keep the confidential piece because it's better to not lose trust, specifically when a person is actually talking to you, you know, like a person is talking to you about the issues, but you can, when you gain the trust of the person, then you could slowly introduce, I think you need more help, or like, I think it's better to talk to that another person. But the one thing I would not like, if the person is self-harming or suicidal, I'll definitely tell someone, because it's out of your scope already. It's out of like your friend scope. You know, like you need someone professional to help you. So these are the things that I call red flags. Like if the person, how I ask for red flags is that, hey, do you have thoughts of killing yourself? And also, do you have a plan of killing yourself? And if those are like yes and yes, and then, oh, I know where to get something to kill myself, then I would definitely ask for more support. And that's where you have to draw the line of like, no, I'm not gonna like call someone, right? But if there's like not a high risk, then I would keep the confidentiality of, okay, I could keep the secret for this time, but you still listen to them, so that they could gain trust, and then you open that door up. Yeah.
Awesome. Thank you for clarifying that.
I think a question that was given to us was that, how do we know if we have depression or a phase of sadness?
That's like a lot of people ask about it, especially when they're grieving or break up, or like something, stressor in life. And the committee also like asked me that question beforehand, so I came prepared. One thing about diagnosis, so depression is a diagnosis, right? And that we have this huge book. So this is called a DSM-5, it's Diagnostic and Statistical Manual of Mental Disorders. And I kind of like tell the clinician, or tell me, what is depression, or are you depressed? So that's how I tell if a client is depressed. So generally, if I flip to the major depressive disorder page, there's some criteria that you need to hit. So for example, there's like 9 criteria. It could be depressed mood most of the day, nearly every day, or tearful or sad. So there's like 9 different criteria, and you have to hit 5 or more criteria in order to consider yourself as depressed. So that is the clinical terms that I am sharing with right now. Like clinically, it is easy for a clinician to say, oh, you hit these things. Oh, you significant weight loss when not dieting, or gain weight. So that's one of the criteria. You hit that. Insomnia or hypersomnia nearly every day. You hit that. So that's how I tell a person is depressed. But when you're talking about in general, if you're a friend, it's difficult for you to tell if the person is depressed or not, because the person could act like they're normal and friendly, but actually they cry every time and they hit all the criteria of depression, right? So it is not our job, like normal human being, to diagnose a person. You need a professional to diagnose a person. So I will leave it at that. If you think that a person potentially has depression or have a long depressed mood, seek help. Tell them to seek help.
Thank you to whoever asked the question. Anyone else? Feel free to chime in. Those on the phone.
I had another question, Diana. If you are or if you have been helping a friend and they continuously go to you, but then you start losing like the emotional energy or capacity to help them, or your leadership position or some kind of job where you might have to have a lot of conversation, how do you prevent yourself from like experiencing like vicarious trauma or that energy, and how to step away from that situation if you feel like you can no longer handle it?
Vicarious trauma is a real thing, you know, like even for me, like when a person is having so much trouble in a session, like I will feel down as well after the session. So a lot of times I will tell people about self-care and like how you could regain energy yourself, and how do you take care of yourself first. You have to take care of yourself before taking care of others. That's all my supervisor always tell me. So you have to know your limit, right? Because if a person is seeking help from you and you are not able to provide that, it is not best for your friend, right? And also, it would make you want to distance from your friend further and further away, and you don't want that. One thing I always tell my clients is that you have to find your own community. You have to find more and more people to help you with your issues. It's like if you're dating and you have a breakup, right? You want, and your friend is like telling you all about it, but you want them to actually find new hobbies, new experiences, or help to support them. There's not an easy answer that I could like tell you to, hey, no, like just stop talking to them. But also at the same time, like if you know your limit is there, you could tell them, hey, I cannot help you anymore. I would like you to like find someone who have better tools to do it. You know, seek help and stuff. So it's a hard job to be a listener all the time, especially in a friend. So that's why therapy is different. Therapy is not a friendship, is not reciprocal, right? Like the therapist wouldn't tell their personal issues to a client, right? It's a one way. So that's why therapy works well, because you're not sharing the burden, but the therapist is taking on that and knowing what is like the goal of therapy.
Thank you.
Diana, you mentioned self-care earlier. Can you explain what that is and give us some examples?
Okay. So self-care to me is walking the dog, but it could be different for different people. So it could be like, in how I see it is that intentional way of treating yourself. It could be small, it could be big. It could be as big as a vacation. It could be as small as like, I'm taking a deep breath for myself right now. So it's the intention that matters more than the action. Right? So there was a time where I worked at a very high level trauma place, and my self-care to myself is washing my hands after work before leaving the building. And so that is a very simple act of like, okay, I'm going to wash away the emotions or the trauma that I'm dealing with today, and I'm going to leave it here. Right? So that's a different way of self-care. It works differently for different people. And I always try to find what works best for my clients in terms of self-care, because when they could take care of themselves, their mental health will improve. And then eventually they don't need me anymore. They could regenerate.
So is it conscious and habitual then?
Yes. Conscious intention of taking care of yourself.
I don't know about everyone else out there, but when Diana talked about taking a deep breath, I definitely took a deep breath. Anyone else? Feel free. This is a safe space. Um, let's talk about, if you don't mind, changing directions and talking about how do we talk about mental health and get rid of the stigma? Is there a certain language that we need to use to, say a friend opens up to you? Is there a language that you should use and shouldn't use? Or how do you talk to your parents about it? And these are multiple questions and very open-ended, but
I think this is the first step, like, doing the webinar and like start talking about it. The thing is, like, the more you talk about it, the more people are more accepting to it. It's just like many other things. Like if you talk about Facebook, people will start using Facebook, right? Or Snapchat. But I think there is a stigma and in the Asian culture, and how I frame it is that therapy would help with something. So it's more target oriented and skill based. That's worked really well with Asian families and Asian communities. Like you go to therapy and you could learn how to have a better relationship with yourself. How awesome is that? Right? Rather than going into like, you go to therapy to fix your mental health. Right? The other thing is like, whatever language works, then I'll use that. As I mentioned that before, I use chit chat with an elderly client, and that works. I use the term play with kids. Like they don't really know it's therapy, but I'm like, hey, I really want to play with you today. I really want to. So the energy is like, I really want to know you. I really want to know what's your process like, and I want to know your patterns and how you relate to people. So that is the key. Using the language that is suitable for the population. And also, another thing I just thought about is finding therapists who is culturally aware. Like, for example, if you have Asian parents, find an Asian therapist who speaks their language. That immediately will have a very different effect than finding like a white person to support your treatment. Right?
Thanks. What about the other way around? So if you want to talk about your mental health issues to your family members or to your friends, how do you do that in a way that's relatable or that's understandable?
That's hard because you're kind of like telling them what you're experiencing right now. Not a lot of people understand mental health. Like, for example, there are people who I said, hey, do you know what is PTSD? They actually don't know what it is. So rather than, of course, you can put a label on it, on things like depression or anxiety. I always try to encourage them to describe their experience. So rather than labeling, tell them, when I go to a crowded area, I feel that my body tenses up, I'm like collapsing, and my heart rate goes up. And so those terms is easier to explain to family members or like friends about what you're experiencing. And actually, the more that you tell them that, the more that they're aware. I always tell my my clients who is in the spectrum, like to actually describe the experience to people, so that actually people could help them when they need help. Yeah.
Thanks. Got 12 minutes left. Feel free to continue asking questions, guys.
So you kind of just how to talk to children, like about playing. How would you explain to them like what mental health is?
Explaining to children about mental health?
Yeah.
Okay. It depends on the age, right? Like if it's a really young kid, then it's very different from like a middle school or high school person. For a really young kid, I typically don't mention it. I do the treatment without, I will tell them, oh, you're seeing a therapist. And a therapist is kind of like, you could try to understand how you're doing. And if you're sad, you could tell your therapist about it, or what makes you frustrated, or, you know, things like that. But for older middle school or high school, they sometimes don't understand why they're in therapy, specifically if they're referred by teachers, you know. But if they see how fun therapy is, or like how useful therapy is, then they tend to like lean towards therapy. One thing about middle school and high school kids is that if you're with them, what I mean being with them is that if you listen to them, look, when they tell you about breakup, you really is like feeling it with them. Or if they tell you about a YouTube star that they really like, you know, you go and research about it and like talk to them about it. And that really helps bring the bridges together. And when they are in, I think, high school or like middle school, I think depending on the age and the cognitive ability of the kid, then mental health could be introduced. You know, like the mind needs to work sometimes, and how we relate to people is affected by how we're bringing up. And if you have a single parent or like abusive family, you bring up differently, and I would like to help you with that. You know. Yeah.
Hi, Diana. We just got this question in. Is if your partner or significant other has a hard time connecting and relating with people, how do you approach couples therapy?
Mm-hmm. Yeah, that's a hard one. So couples therapy, there are different ways, different style of couples therapy, and you have to understand. So there was like if you Google or research about it, there's like Gottman couples therapy style. There's like emotionally EFT, which is like emotionally focused therapy. For couples therapy, you need the couple to want to be together, right? If you're not thinking, you're thinking of separating, like there's no point of couples therapy. But how I approach it is that I would say, hey, I think it might be beneficial for us to have a person to give us some skills on communicating. So if you frame it in a skill-based session, or or even like, hey, I really want to understand you more, and on how I could actually relate to you better, then that might be the way to go in. It depends on the person too. I think that's how I do it, but also take advantage of free sessions or like free consultations with therapists, so that you could say like, oh, I just want you to try a little bit. Like if you want this relationship, we could try for like 3 sessions and see how it goes. Maybe you'll like it, you know. And also open it up to say, if you don't like it, we could find another person. Always leave that door open, so that it's not like, oh, if you go to therapy, it doesn't work, then that's the end of the relationship. If you go to therapy, that therapist doesn't work well, you go to another therapist, right? I would suggest you guys to research about, if you're thinking about couples therapy, research about EFT, which is emotionally focused therapy, and also Gottman therapy. Gottman is more cognitive based, where you will do assessment on the relationship. It's more for people who doesn't trust therapy as much, because if you do assessment on a form, that feels safer for people, right? Emotionally focused therapy is more geared towards your attachment style with your parents and how that affects how you relate with your partner. I hope that answers that question.
Another question that we had come in was, what are the most prominent issues that you're dealing with within mental health in your clients as of recently?
Recently, my clients is mostly preschool age, so families who is working with divorce or like co-parenting or like behavioral issues with kids. I think for me personally, I like working with high functioning adults who have some kind of relationship issues or patterns that they notice. For example, I have clients who work with like how they relate to their partner and how the person is always into the loop of like being a caretaker for everyone. So those are interesting cases. I love clients who kind of able to track themselves, able to see the process of therapy, because I don't want them to like see me for the rest of their lives, you know, like, but I would like them to like see the progress of therapy. Some people want to have therapy sessions once a week. Some people want therapy sessions like every 2 weeks. So it really depends on the client. Yeah, my client is like more broader than normal people, because I do nonprofit work and also do online drama therapy as well.
Sorry, my internet's dropped out. So I apologize if this question's already been asked, but it's more of an opinion question to you. But why do you think that the discussion over mental health is never really looked at in Asian households or Asian communities?
Because the stigma of mental health is so big. If you brand it as like, let's talk about how to make your kids go home for dinner all the time, you know, like that might sound better to a family or like parents who is having trouble relating to their children who is in university level, you know. So I think well, if the previous generation is not open to it, well, let's start with our generation to be able to like talk more about mental health, how it affects study, how it affects the workspace, how it affects the relationship. And I think nurturing that is very important. The openness of it, right? If we don't push it, like our next generation will not benefit from it. Yeah.
Thanks. Anyone else have any questions?
I saw this question come in and it made me laugh. It said that, in a good way, that this is from Jin, and they said that they're planning to attend their first UNAVSA conference this August, and that they were wondering how you would go about bringing mental health as a priority in a conference at this scale as an attendee or a workshop presenter. And I'm really happy to announce that Diana will be a workshop presenter at UNAVSA 15 this summer. So we are really excited about that. But yeah, raise your voice when it comes to what you want to see inside of our conference, especially just letting UNAVSA as a whole know what you would like to see. So yeah, I'm really excited. So Jin, she's going to be there and we're going to make mental health a priority.
Yeah, like what I present is not fixed in stone yet, but obviously I'm going to talk about mental health. So if you want to shape the presentation, or like you want to give input on like what you want me to talk about, because it's all about the community, definitely let me know, and then I'll tailor the presentation towards that aspect as well. Yeah, but I'll be there.
Ooh, thank you. Yeah,
I have one last thing. Actually, I have one last thing to talk about, is that when we talk about like Asian community, a lot of times my education is from a Western background, right? How I see mental health is in a Western lens. And I want to put that to everyone to think about it. You know, all the papers and research done is in a Western lens. There's a lot of Asian, I don't know, like rituals or even ways that they communicate and think about relating with each other is very different from the Western diagnostic kind of perspective. So doesn't mean that one way is better than the other. Your parents or like the Asian community might be using a different way to relate and to support their own mental health. It could be just chit-chatting. It could be going to the park and do exercise, you know, like things like that. So having that open mind concept on how mental health would look differently in different cultures, that's very important.
Thank you for that. I think we're coming up on that hour mark. So if anyone has any last question, feel free. Otherwise, Diana, feel free to plug your podcast, how we find you online, Twitter, Instagram, Facebook, websites, etc. I know you offer online therapy services as well.
Mm-hmm. Well, yeah, you can find me at dianachutherapy.com. You can email me at dianachutherapy@gmail.com. And yes, I do have a podcast, which is my side effort of trying to put mental health awareness into like the Asian community. It is done with my colleague who was a psychologist, and he and I will talk about like random stuff about mental health, and we'll try to bring in like as much Asian culture and background into it. So I'm not like great at it like necessarily, but yes, my podcast is available in the Apple Store, Apple Podcast hosting system, and also in the Google, and it's called Waves of Change, Modern Perspective on Asian American Psychology.
Fantastic. I'm definitely going to subscribe and listen to your podcast. So yeah, any last questions? Otherwise, we can look forward to seeing Diana at UNAVSA 15 in Atlanta. All right.
I had one last question, Diana. That's
Yeah.
okay. What advice would you have for anybody that might be seeking to go into a field of therapy?
The field of mental health?
Yeah.
Okay. Yeah. So do your bachelor's in psychology and see if you like it. That's the first thing. And also, when you go into it, think about, specifically if you want to go into a master program, think about what orientation you would like to be. Like it could be a CBT therapist, you could be a drama therapist, you could be expressive arts therapist, or like somatic therapist. So think about the orientation on how you want to work with, be useful, right? And then research on it. The other thing is the licensing system is very state specific. So if you want to stay in Virginia, for example, you go to a school which goes with the Virginia kind of like board system, and you could find it out online easily. It's difficult to transfer the licensing process in the first few years, but after you're like more experienced and gain more hours, obviously it's easier for you to like move states and like find a different job. So those are some of the advice. And feel free to reach out to people. Reach out to mental health professionals which have similar background of yours, like Asian community or even like the population that you want to work with, and ask them how did they get there. I did that for myself too. I called a drama therapist in Hong Kong and say, how do I become a drama therapist? And then they will tell you how.
Thank you.
All right. Thank you so much, Diana, for joining us today. That was extremely informative. I
Thank
learned a
you.
lot. I'm sure everyone
Thank
else.
you for inviting me. This is really fun. I'm reaching like more people than like one therapy session, so it's good.
Yeah, I think we had 20 people on at one point, which is fantastic. Yeah, thank you everyone joining us for coming and listening today and giving your questions. Hopefully you guys got as much out of this as I did. We'll be hosting more of these in the future on various topics. Go ahead and say bye to Diana, and yeah, that should be it for the night.
Thank you,
you.
Diana.
Thank you,
Thank
Diana.
you.
Oh, Jenny, I think you had one last thing to say
Did
before we left on talking about mental health with your VSA.
Oh, yes. So the Civic Engagement Committee has been creating pieces and resources for you to actually distribute to your VSA, and that can be anywhere from a PowerPoint slide that goes over what the bystander effect is, and this can go over mental health issues as well as sexual assault, because that was a past month topic. And so yeah, we will definitely relay those via newsletter, and then once VSA Academy has been boosted and started, then we will have that available on that, which is basically a VSA Google, if you will. Yay. Also, this webinar was recorded, so we will broadcast this again for people to re-listen to.
Yeah, if you guys have any questions regarding this webinar or any of the information that Jenny just talked about, feel free to email us, civic.engagement@unavsa.org, or find me. I'm David Tran. There's a lot of David Trans out there, but david.tran@unavsa.org as well. Thanks again, Diana.
You're welcome.
Have a wonderful night, everyone.
Bye.